My name is Chase Beaty. I'm 30 years old. I live in Jamestown, Tennessee. I'm currently in the major of interdisciplinary studies. After I graduate from this degree, I plan to either rejoin the military and continue my prior job, which was psychological operations, or I'll do a career in law enforcement and do detective work. My interest will be in criminal psychology with a research topic that shows correlation between genetic traits, specifically MAOA-L, and trauma and violent criminal behavior. So for the research question, I would like to answer, does certain genetic traits, specifically MAOA-L, and trauma experiences increase the likelihood of violent criminal behavior? In the first article I read about was 18 men who had past violent offenses and 20 healthy men who had no offenses. They were given MRIs, psychological tests, and genetic tests. From the conclusion of this study, it's shown that people with these specific genetic traits showed more correlation with violent criminal past. From the conclusion of this, one can conclude that these genetic traits do increase the violent offenses. This is good for the study of psychological criminal behavior because we can now get a better understanding of these traits and how they correlate with these violent offenses. This is also an example of correlational research. In the next article, they collected data from 872 twins determining whether psychopathic traits, environmental factors correlated with criminal behavior. They did this through psychological evaluation, surveys, and interviews. Concluded from this test was that not only does psychological traits play a role in criminal behavior, but when added environmental factors, it also increased the chances of criminal behaviors. In the terms of criminal psychology, this research moves forward the explanation of these criminal offenses, not just with genetic traits, but also with environmental factors playing a role in creating these violent offenses. This research moves forward the study of the correlation between genetic traits and criminal behavior, also with the correlation of environmental factors that play a role in these offenses. My preferred methodology is going to be quantitative correlational methodology with a 2x2 between subjects factorial design. It's going to be correlational because we're going to observe the correlation between the genetic trait MAOA-L and the levels of trauma, which is going to be high or low. It's going to be between subjects because, of course, the participants will not be able to experience each independent variable since it is prior history. And it's going to be a 2x2 to get a reading of these independent variables, and the 4 levels of the independent variables is going to be a genetic predisposition, with or without, and trauma, high or low. And of course, it's going to be a correlational methodology because none of the independent variables are going to be manipulated, since this is going to be prior history of the participant, that we will be conducting this research to gather a better understanding for criminal offenses, which will be the dependent variable. The strengths of this research with using especially a between subjects design, each participant will only experience one condition, which will reduce the carryover and practice effects between each test, since it's prior history of genetic traits and trauma. Also, with using a between subjects design, this allows for more participants, which will mean there's also more independent traits and their levels from being a factorial design also, which will allow for more data to be collected and more understanding of the influence that happens between each of these influences on the dependent variable. The limitations for using this research is going to be, one, the participants. The more participants we have to find, which is going to be more effort and more challenging. It will also be finding the correct number of participants to get the accurate information that we need. Confounding variables to the dependent variable, which could be socioeconomic and also substance abuse. It could also be playing a role in the influences. And also measuring trauma is going to be very difficult and can also be very hard for inter-rater ability for reliability. Next, we're going to talk about reliability, which reliability is how consistent the variables are in a research study. Some of the reliabilities in this is going to be, of course, genetic tests are reliable and consistent, which allows for consistent tests, retests. Also, a thing that might affect reliability is the when giving surveys or interviews to these participants, the social desirability of how they answer a question might affect the reliability of this test. Next, we're going to talk about validity. Validity is the accuracy presented within a research study to measure different variables. Some of the strengths and weaknesses to the variabilities, using real-world data from genetic traits and from criminal background increases the validity of this research. And also, we need to make sure when we're picking these participants that the sampling of the participants represent the population that we're trying to study, which should maintain the validity. Also, as we talked about before, confounding variables can also be a threat to the internal validity of this research. Next, we're going to get into data collection and analysis. We'll be using archival research to collect the participants with genetic traits that have MAOA-L and that do not have. And we'll also be using criminal records to find participants who have criminal records, of course. Then we'll be using stratified probability sampling to best pick these people in these subgroups to get a better equal evaluation of the whole population. Then we're going to use surveys with closed-ended questions that will be used to examine the trauma levels and obtain numerical data. There's some of the concerns is, especially with the surveys, is construct validity from poorly worded questions that might not get the accurate information that we need for trauma. One will also need to ensure that it is ethical and consensual, adding respect, beneficence, and justice to the research of the participants. One way we're going to be analyzing this research is going to be two-way analysis of variance, which will be ANOVA, which will measure the main effects and the interactions between these independent variables that they have on the dependent variable, which is criminal behavior. This approach allows for both the individual and combined effects of genetic traits and trauma to be evaluated. We'll use this information to determine whether the data rejects the null hypothesis or fails to reject it, and assess the level of significance that the independent variables had on criminal behavior. So we'll go into my conclusion. So the research question is, do certain genetic traits and trauma increase the likelihood of criminal behavior? This method is quantitative, correlational, between subjects, design 2x2. Challenges is going to include, gathering all these participants, selection of participants, confounding variables, and also measurements of trauma. With this, you'll be able to hopefully after this research, one will better understand the effects that genetic traits and trauma have on violent behavior, criminal behavior. And through the right resources, time, sampling, this research can find a better solution going forward to what causes these violent offenses. Thank you. My name is Chase Beaty. I appreciate it.